viewers, I am Ms. Fatou Baji, the current Deputy Information and Communication Minister of the Nursing Students Association of the University of the Gambia. Welcome to the first health interview that is brought to you by the 9th Executive of the Nursing Students Association. Here with me today, I have a renowned researcher and one of the greatest scientists in the Gambia, who has completed his BSc and then his master's as well as his PhD. This has shown how great this man is. And he is no other but Dr. Usman Bajinka. Dr. Bajinka, you're welcome and thank you for having us here. Kindly extend your greetings to our viewers and introduce yourself.
Thank you so much, and that was well complimented. I'm not sure if I'm one of the best scientists in the country. Perhaps we are the young doctors, young PhD holders and researchers, as you can say. And of course, I will say hello to all the audience. And then, like she said, I am basically Usman Bajinka, PhD in microbiology, of course, obviously biological science throughout my career, and now a postdoc in cancer research with Shandong Cancer Institute at the Shandong Force Medical University in China. And I'm also a full-time lecturer at the University of Gambia.
Thank you so much for that well introduction. Now, October being the month of breast cancer awareness, we deem it necessary to have this session with you. So I will ask you a few questions. The first question I would like to ask is, what is breast cancer and what is its research in the sub-Saharan Africa?
Thank you so much. This is a good question, and of course, this is a breast cancer awareness week. 1 in every 8 women will be diagnosed with breast cancer in lifetime. This is a huge number if you look at that statistics. And it's not only for women. Even the guys, we have 1 in every 1,000 men are likely to be diagnosed with breast cancer in a lifetime. So cancer as a whole is an abnormal growth of cell. So when you say abnormal growth of cell, it's like cells that actually decide to grow abnormally. They do not follow the trend of cell division, because we have cell divisions go through the phases and all those, and it only happens when the body's that particular cell requires to be renewed, like old age will go and new age will come. However, this is different for cancer cells. Cancer do not really wait for the protocol. They just go randomly, and then in doing so, they tend to deviate from the normal health condition. They tend to cause what we call cancer or tumor. So when you bring it down to breast cancer, it's one of the most, of course, it's the most leading cause of gynecological breast cancer. And sub-Saharan Africa, of course, is the leading cause. The research trend with regards to breast cancer in sub-Saharan Africa is still very primitive. Primitive in the sense that we still do not get into the nitty-gritty of breast cancer in sub-Saharan Africa, because we know that cancer as a whole has been seen as a genetic disorder. When we were young, we learned from textbook that it is actually inherited. People thought once you come from a cancer-prone family, you are the only person likely to develop cancer. But as knowledge has been expanded, with regards to the Warburg theory of cancer in 1920, the German chemist or biochemist realized that now cancer is not a problem in the DNA. Instead, it's a problem in the mitochondria. So when it comes to mitochondria, then we have to talk about our behavioral approach, our lifestyle. And this is the way we can actually try to at least control the level of cancer transmission and, of course, prevent some of the occurring cancer, especially breast cancer. So the research at Sub-Saharan Africa, I will not appraise it bad, but I will still will not give that much accolade to the Sub-Saharan African scientists, because some time ago, this was 2 months ago, while in China, I and my colleagues, I'm the first author, we wrote an article about cancer education and awareness in Sub-Saharan Africa. And this is a systematic review, meaning it comprises all the studies that are actually done in Africa with regards to cancer. And breast cancer is a must that occurred in that study. So I think we will talk about that later. But if you want me to appraise it, we still have a lot to do with regards to breast cancer research.
Thank you so much for that well-detailed answer. Now to the second question, Dr. Bajinka. It would be, what are the problems of breast cancer in the sub-Saharan Africa?
The problem, if we can relate it to research, I think I will be able to say a lot on that. However, with regards to the diagnostic, treatment and management of breast cancer, I will not be able to say a lot on that because I am not a medical doctor, neither a nurse. I know the risk factors actually is, old age, including dense breast. This is our physiology. We can't do anything about it. The history of breast cancer you've been having it previously, still going to be a risk factor. Parents or siblings actually having a breast cancer. The mutation type, if you are not lucky to inherit BRCA and type 2, and alcohol use, of course, and overweight and obesity. So if you will advise ladies, and of course some guys, is to try to maintain or balance their weight. Well, if you will bring down this perspective to research, knowing a problem is half we are solving it. We can only affirm and fight or try to manage or, of course, limit the breast cancer transmission, and of course we can prevent it if we are willing to really get into the health education perspective of it. There is still an inadequate health education perspective. I will speak firmly, that's because we conduct a systematic review, and this, of course, leave no stone unturned. The cultural demands for sub-Saharan Africa with regards to clinical trials is still very low. The perception that we have when we said, can we all come for screening to see who is actually is living with a breast cancer, or who is likely to develop breast cancer in few years later, the attendance, the participants is still going to be low, even among the female population, despite the fact that they are the ones with the high risk. So this goes with the high cost. If you will want to go to a provincial village in any of the sub-Saharan African country, or you want to go to what is the poorest village in Badibu, and you want to bring all the Badibunkas to come to Farafenye to do breast cancer screening, it will require you to hire transportation, and they will even tell you that they will need their allowance because you're actually diverting their farming or daily stuff, so you need to give them small money. So this is a high cost that actually has to go with breast cancer screening. Well, if there is money, of course, the high cost procedure will be a thing of a past. Another thing could be lack of interest. Yeah, and no one is actually free of breast cancer. It is either going to be you, your spouse, or your children, or your grandchildren. So the more you are health educated in this perspective, the better you are contributing a role. And depleting health system could be one of the key factors in our contemporary health ministry in the country. It is sad to say, but we still struggling with a lot of things, infrastructure-wise, diagnostics capacity, and even the patients or participant satisfaction. You cannot bring people to come for breast cancer screening at the breast cancer clinic, and when there are no proper accommodation to accommodate before their time, this is actually, bringing the marginal utility down. The participants will not be happy, and the depleting health system will have a role to play in that aspect.
Thank you so much. And now to the third question, Dr. Bajinka. I would like you to elaborate on the digital health services when it comes to breast cancer.
Digital health service, the last generation technology, and one of the most cutting-edge health innovative that modern people are blessed with. This is still inadequate regarding sub-Saharan Africa and Gambia in particular. There is still an inadequate digital health and health service. Some might even argue that it is not yet thing in Gambia. Why? Because it's the high cost of digital health. However, it is only when the female ministers and the directors are healthy, free of breast cancer, that they will go to the parliament to discuss on the policy, right? So this shows that the importance attached to health and health management can never be overemphasized. We might tend to neglect some of these minor things by buying one big, or probably furnishing one big satellite report, which will be using high technology signaling. For example, any woman, even as far as in the last villages in Basse, will be able to access her phone to call a number and to explain the changes she's seen recently on her breast. And that particular communication will establish whether that woman requires an urgent breast screening to the nearest breast screening facility. This has to go with establishing breast screening centers. 1 in every woman in Gambia is likely to develop breast cancer, and this is of high mortality. It kills. It is not malaria where we are actually combating. It is something that you might go with a lifetime. Implementing digital health service will actually avoid the reduction in the willingness to attend or to go for breast screening. For example, the long waiting queue will go down, because now you are no more going for a queue, because you know exactly when is your appointment, when is your screening through digital health. And there will be no lack of confidence or confidential insurance. For example, you know exactly the breast cancer clinic you're going. Perhaps you already got your folder in that particular clinic. And then, of course, time in, time out, periodical screening will help prevent you from developing, or perhaps you even let you know that you tend to develop, or you have the gene, or you're carrying the gene, through the help of communication. But all this has to be documented through computing, telephone devices, SMS, and even surveillance can also be filed into a digital health service for the country.
Thank you so much for that answer as well. Okay, now to the final question, Dr. Bajinka. I would like you to elaborate on the financial and health administrative structures when it comes to breast cancer.
Big question. And I will not actually implicate myself, but I will talk about inadequate financials and health administrative structure in the country. With regards to the little that I know, poverty is a big factor. Everyone, almost 70% of the Gambian population is actually not very rich. We all struggling economically, and unfortunately, this is not reflecting on our needs with regards to health. Basic health should be more or less free. I know that there is no country that is offering free health service, but the basics are offered, and then we can move on to the other needs. Specialized clinics is a very big issue in our country. We still do not have very big specialized clinics. So we have small clinics, we have courts, which is obviously is a roadmap to accomplishing a lot together. But we still do not want to pay attention to designing specialized clinics, because this will actually help us to manage the limited resources. Let me speak of personal experience. In China, where I did my PhD, this is called Sanya. Sanya these are hospitals that are built through the vision of Chairman Mao. If you will study Chinese history, philosophy, one of the greatest men ever live in China, Chairman Mao, he decided that the southern Chinese will not move to abroad for treatment. So he built 3 hospitals. In 2018 alone, these hospitals we call it FUI, FUAN. These first hospitals registered 3 million patients, which is more than Gambian population, just in 2018 alone. How they operate is highly specialized. How they place their staffs is like walking distance to the hospital. This is a way of managing a resource. This is something that I am still looking forward for Gambian ministry and Gambian government to consider with regards to health, because health is always emergency. All the doctors that are working at the Edwards Francis Small Teaching Hospital should be living nearby. It's not very difficult to accomplish. The government can build apartments at a subsidy rate for the staff in the hospital. This is a way in which we can manage health, we can manage our finance, and we can confer optimal health administrative. Because we will know, no doctor will be at home saying I'm sick, because if you are sick, you come to the hospital. No doctor will say I'm caught in the traffic, I'm tied by social or family issues. But if that happens, meaning no patient will be left unattended, the diagnostic accuracy will be optimal because we are at work on time and you know the number of patients you are receiving at a particular day. So obviously your efficiency with regards to diagnostics, when it is left on human capacity alone, will be dealt with. Even though we still need to do some robust with regards to laboratory advancement, we still need to move from physical or relying on only clinical, especially going down through how will I call it? I will not go much about that, but supplies are also out of stock in our hospitals. You cannot call people to come for breast cancer screening when you are using only one glove to see every woman. Maybe 1 out of every 10 women will actually tell you that, can you change your gloves? And if you cannot, that particular woman is likely not to come for the next breast screening. And the information will spread. People will not come. So these are one of the things. Another key factor will be, I don't know how it is in Italy. If you go to their research centers, if you want to become a financial secretary or maybe assistant secretary, you will have to get some basics as a nurse, and then you work in the health facility. So here we have people who are actually has no clue of what is health, no clue of how to implement that working. I do not mean to undermine, but if you can include basic health or basic health education to all the employees working at the health sectors, then we are trying to move to the state-of-art department in regards to health. And we are trying to create a more vibrant and understanding environment for everyone to work at. So I'm not sure if I'm not taking the time, but this way we can actually administer our health financially. We will know what to do on, because everything is actually at the disposal. Yes.
Thank you so much, Doctor, for that well-detailed answers throughout the session. Now, I would like you to give your final message to the general public.
Thank you. And my general message will be a bit short. Breast cancer is one of the most health burden, and it is killing at a very high rate. It is a global issue, sub-Saharan African issue, and particularly a Gambian issue. The hereditary breast cancer type for instance, BRCA is very rare. The breast cancer genes can produce tumor suppression proteins, and this is actually not research in Gambia in regards to basic science or basic medicine. We do not have such research. I know we have a population-based study, breast screening and all those, but we still need to have small projects actually deciding to know what are our personalized medicine perspective with regards to breast cancer. There are more than 1,800 BRC mutations. We still don't know what exact mutations the Gambian populations are under. We need to know that. Some factors will make us higher risk factor for a type of a mutation. Carriers can have up to 85% risk of breast cancer. And we have a good number of carriers in Gambia, according to the data from the breast cancer. Breast cancer is no more an old age. We are now seeing young age trying to develop breast cancer in our country. This is a cause for a concern, What went wrong? Was it a lifestyle? Because I know that even spontaneous mutation do occur. Obviously, we inherit some, but life career or lifestyle habit need to be something that we need to check up. We need to increase the chances of, because breast cancer increase the chance of ovarian cancer. My postdoctorate fellowship research is on ovarian cancer, even though I'm not looking at the education health aspect, but I'm looking at the drug resistant mechanism. So there is a relation between the genes or the tumor suppressor genes for breast cancer and, of course, the ovarian cancer. So, of course, if there is a high rate of ovarian cancer, this will not only lead to mortality, but, of course, infertility to our population. Higher chance of more aggressive breast cancers are, of course, tend to be seen if we are not making efforts to prevent it. We can inherit a gene from either parent. So it does not mean that once you get breast cancer, you inherit it from your mother. You can inherit it from a father as well. The gene could be very recessive, but you can still inherit it from male parents. Surgery is not the only option. Please spread the message that tell the women that you're not going to go for breast surgery. This is a very scary thing that actually is taking them away. We have other options that they might not go in for surgery. Not everyone with a mutation will get breast cancer. So even though you are detected with the BRCA type 1 and type 2, this does not mean that you are going to have breast cancer. So not all mutations are expressed. With that, I will, of course, try to say thank you for the opportunity that you accord to me, and I hope we will learn from it, and we tend to work together with regards to preventable health approaches, and of course to make Gambia a very healthy, which is also very young population, very healthy, in fact, very healthy. If I say healthy, I've seen people who are really obese in different parts of the world, and still our Gambian people are not obese and overweight. So we still have a very healthy young population, and thank you.
Thank you so much. Surgery is not the only option for cancer treatment or breast cancer treatment. Ladies and gentlemen, to the final stage of this session, we thank you so much for joining us. And Dr. Bajinka, thank you so much for having us here. Take care of your health, because your health is your power. Thank you.